We go back to our earlier story on COVID-19, the fact that cases are going up and most people are certainly not observing the COVID-19 protocols. Joining me for a conversation is Managing Trustee, Ghana COVID-19 Private Sector Fund, Senor Hossi. Indeed, this fund helped put up the only infectious disease and isolation treatment center that we have located here in Accra. Senor, a very good morning to you. I've been following you closely. You posted that COVID-19 is in with a big bang, talking about ICUs being full, medics and supplies overstretched. How do we go back to when we used to take COVID-19 seriously as a people and as a country?
Yeah, good afternoon. Good morning, Mama B. The connections is a bit weak. Could you please go over your question again?
So I'm asking, how do we get back to when we once used to take COVID-19 seriously as a people in a country? Hello, Senor, can you hear me?
Yes, I can. I can hear you now, very loud and clear.
Okay, before I come to the question that I was asking you, let's appreciate from where you sit when you talk about ICUs being full, medics and supplies overstretched. How seriously is this matter?
It's a very serious matter, and there's a need for us to actually change our general orientation to dealing with this particular problem as a country. There's a total loss of agency, and I don't think the government's communication and management of events have really helped heighten the agency that's required. At the beginning of this entire pandemic and its entry into Ghana, there was a very high sense of caution. And it was because government had heightened the alert level as well as the agency that was required to deal with it. With the politics coming into play, there's been a major change and shift in that entire phenomenon. And we've seen all of us lowering our guard. And I think that definitely has to change. Our ICUs are full. It's not rocket science. These are facts. This week, I have lost 2 friends, and then I've actually had a very close friend lose a niece. So in effect, 3 people very well connected to me, all in this week. I've had a lot of cases being reported, and a lot of friends reaching out to me to help them get a bed here or a bed there. It's becoming unsustainable. Our health facilities are getting highly overstretched, and Ghanaians must realize that there's a major agency at this time, and the politicians and the government people, the public officers, must communicate same so the public can react appropriately. It's just unfortunate. You know, we started this with a lot of testing. We started this with a lot of tracing, a lot of consciousness and awareness, and all of a sudden, everything fizzles out. You get COVID today, nobody's going to be asking you who you've been in contact with. Nobody's going to come in to try and test the people you've come into contact with. It's as if nobody cares. It's like as if we are back to business as usual. I mean, that to some extent will be acceptable under certain circumstances, but not under a COVID circumstance at all. No tracing goes on. I've had friends, I have colleagues in my office who have got COVID, and when they get COVID, nobody reaches out to really ask, you know, where have you been? Have you been working? Where are those there? Nobody reaches out to see if you have those you are in touch with also having COVID, so we can help stem the spread of this virus.
So, Senor,
there is nothing like that whatsoever going on.
Senor, I've got to ask you, so how do we get back to taking this disease seriously? What must be, who should begin it? I mean, where do we put the pressure?
I mean, it definitely goes it goes back to government. First of all, the politics must stop. You know, the politics must stop. The suppression of data must stop. The deliberate, disregard or suspension of tracing to help keep the numbers down must also stop. People really need to know that this is widespread. It is not 1,000 and whatever it is that's being bandied around. This is dishonest. It must stop. Start being truthful with the people so people realize that there's a real agency in the country. Otherwise, sooner than later, all our health systems are going to crash, and you will not even get health access for simple diseases, even like malaria at some point. Because there will be no hospital bed for anybody. Our hospitals will get overrun. So the key thing here is the politics stopping, government taking full responsibility and being honest about what is happening, so we can actually get the right orientation and positioning of the public. We need to review our restrictions and intensify them, just like we did in the early days. Our public gatherings, everything is just gone well. We're all doing parties, we're all attending events, we're all having funerals, and funerals have gotten back to the sizes that they used to be. All right, I've been to a few funerals in these past few months, and it's as if we don't have COVID anymore in this country. You know, the restrictions on the number of people gathering must be fully enforced again. All these weddings and all that must also go back to scale, so we minimize that spread.
I thank you so much for your time, Senor Hosi. He's managing trustee, the Ghana COVID-19 Private Sector Fund. That fund helped put up our only infectious disease isolation treatment center. Coming up is business contract between government and real estate players to produce 20,000 housing units annually reaches advanced stage. Darryl Carr has got details in this and more coming up shortly.